Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Afzal binti Muhammad Kamal. I am final year degree at University Selangor. Today I will presenting a case study on thalassemia. The aim of presentation are first to give understanding for students to know the situation and overview of thalassemia. And second, to understand the risk factor, the available diagnostic and treatments of thalassemia. And lastly, to identify laboratory findings with diagnosis of patients. In the introduction, thalassemia is an inherited autosomal single-gene recessive blood disorder, and the body makes an abnormal form of hemoglobin, the protein in red blood cell that carries oxygen. For the thalassemia, it depends upon the basis of the types of the affected globin chains, and for the hemoglobin is made of two proteins, namely alpha globin and beta globins. And thalassemia also occurs when there is a defect in a gene that helps control production of one of these proteins. In the case presentations, this patient is a 20-year-old woman. For the on-general examination, she was undernourished with a short stature with evident itches and yellow thick fingernails. And her skin also was ashen grey in color. For the head and neck examinations, revealed depressed cranial vaults, frontal bracing, maxillary expansions, and its retracted upper lips. And for the intraoral examination revealed bilateral maxillary expansions, frog lines, upper anterior teeth also noted was a yellowish. For the overview of the illness, in these patients was then subjected for hematological and radiological examinations. In the impressions was done from the peripheral blood smear study was that hemolytic anemia favoring thalassemia going for hemolytic crisis. Then this patient was followed by hemoglobin electrophoresis, which is was in favor of beta thalassemia major. For the radiographic findings, the maxillary and the mandibular occlusal views that reveal enlargement of mirror space with widened trabecula. Before that, she transfused the blood. It frequently every month. She was done measured the amount of iron in her blood and evaluated her hemoglobins. And this is a laboratory investigation. First is full blood counts test shown the red blood cell, white blood cell, hemoglobin, HCT, MCV, MCH, MCHC, and platelets. First red blood cell shown the result was lower than normal range, which is 3.36. Then white blood cell was higher than normal range, which is 9.39, and the platelets was higher than normal range, which is 456. And the hemoglobin also shown lower than normal range, which is 8.4. Second is a full blood picture. The blood smear shown the cell was hypochromic than a normal, and the size and shapes was anisocytosis and poikilocytosis. And the cell shown the target cell that looked like a bull eyes under the microscopes. Okay, then in the discussion, thalassemia is an autosomal recessive disorder, also known as Mediterranean anemia. Due to genetic defect, there is reduced rate of synthesis of one of the globulin chains that make up hemoglobin. In the thalassemia patient also, there is deficiency of one of alpha and beta thalassemia. For the beta thalassemia was characterized by reduced synthesis of hemoglobin subunit beta globulin protein that result in microcytic hypochromic anemia and an abnormal peripheral blood smear with nucleated red blood cells. For the prognosis is thalassemia major, it has been improved by transfusions and iron chelating therapy. For the regular transfusion and chelating therapy, with the intention is to keep serum ferritin concentration below than 200 and 2,1500 ng per milliliter is found effective. Although transfusion improves patients' quality of life, but it increases the risk of iron burdens, so concurrent therapy improves survival in thalassemia patients. With the effective preventive strategies, it can overcome the problem of higher percent to get thalassemia. First is pre-marriage test. The spread of the deadly disease can be stopped by having medical tests of bride and groom and avoid marriage between two minors. And for the conclusion, thalassemia is the name of group of genetically inherited blood disorder passed down through families in which the body makes an abnormal form of hemoglobin. For the beta thalassemia is a companion cause to alpha thalassemia. For the thalassemic patients, it cannot be cured, but they are just provided with proper in terms of blood transfusion and proper regimens of chelating therapy. For the lab diagnosis in the peripheral blood films, thalassemia requiring low level of red blood cell and it shown varied size and shapes. And the key of characteristic features for initial diagnosis of beta thalassemia were found to be MCV was lower than 18 FL and MCH was lower than 27 pg. And this is a reference that I follow. Thank you.